expressed and captured in our local Good afternoon, Doc.
Hi.
Yes.
Good afternoon.
You see, we need to find some traditional equivalent for the Zoom using African electronics. But great to have you this afternoon on Ultimate Health.
Thanks for having me.
Right. Last week, we tried to tidy up on the use of enemas, the rectal application or injection of fluids for various medical reasons. We covered most of the territory. Is there anything you feel we need to highlight or we were not able to touch on?
Well, I think that last week we covered pretty everything on enemas. Of course, I think we ended with the complications, but just as a reminder, we said that the complications, the most common complication is actually injury to the anterior aspect of the rectum because of poorly directed nozzle of the enema equipment.
Yeah.
But also other important complications could include renal failure or kidney damage, simply because of the toxicity of some of the substances that are used for these enemas. And we listed that it could be as dangerous as car batteries, and people actually use things like that.
Right.
Of course, sometimes even fluid overload, because again, sometimes people use very large volumes, and if not evacuated, can actually seep into the system or become systemic and lead to complications.
Okay.
And so we concluded by saying that, yes, enemas have some role in medical practice, but certainly they must be, if it's being used, by an experienced person. But certainly if there is an obstruction, so if you have an acute or sudden onset of constipation, then enemas should be your last resort. You should not try an enema.
Okay, great stuff. So we're still down under today. We're looking at the common should I say, lower gastrointestinal problem of hemorrhoids, also known as piles or coko. Now, I started by setting you up and seeing if we can get an Ewe name. I've asked a couple of Ewe friends. I'm still getting just coko. Is there any reason why it's called or referred to as coko?
I don't know the historical background of the name coko.
Right.
But let me be quick to add that as a practitioner, I have come to realize that when the ordinary man says coko, it may not necessarily be applying to what you have described as piles or hemorrhoids.
Okay.
So, in traditional medicine, the term coko has become synonymous with sometimes a red protrusion in any part of the body, or has been used as an index of severe disease.
Okay.
And so you would see many times people would come to the hospital with complaints, and they interpret it as they have coko, and it could be in the eyes, in the ears, in the brain, in the rectum, in the stomach. And so for me as a practitioner, in my few years of practice, one of the symptoms I pray against that patients will come and complain about is that they have coko.
Right.
Because then you do not know exactly whether they mean your understanding of coko or they mean something else.
Okay.
So that's the little I would like to say about the historical background of coko.
Right. Indeed, I found in my reading that I've seen coko of the penis, coko of the eyes, and so many other references. So I guess it renders it a quite vague or ambiguous term. But let's scope it down to what we're talking about. Piles or hemorrhoids. What are these? Yes, Doc.
Yes, hi.
Yeah, I'm asking what are hemorrhoids or piles?
Okay, so hemorrhoids are, it's like distended veins in the beginning of the back passage or anorectal region. And I say distended veins for the purposes of this discussion. So let me just give an illustration. So for many of us, if you look at the back of your hands, you would see that there are some veins there.
Right.
And typically, if you go to the hospital and the lab scientist wants to take a sample, they would apply some tourniquet to the hand to cause some obstruction, and then you would see that the veins become more prominent.
Okay.
Now, in the anorectal region, we also have these veins, and the skin or the covering in that region is similar to what you would find in the say your cheeks. All right, and so you see distended veins. You see veins. Normally they are flat, but if for any reason the flow of blood, and blood typically will be flowing towards the heart.
Right.
If for any reason the flow of blood in these veins is slowed down or obstructed, then these veins become distended and visible, and that's what we call hemorrhoids.
Okay, right. Distended meaning what? Inflamed, enlarged? Can we break that down for my listeners when we say distended?
Okay, so distended meaning that they become bigger than usual.
Okay.
Similar to what you would see. I mean, even if you...
When you put something tight around your wrist.
Exactly. You see that the veins become
What happens
bigger.
to the veins? Okay.
And so even if they were not visible to the eye, prior to applying the tourniquet, they become visible.
Okay.
Right. So once they are visible, we say you have hemorrhoids. Right. Other things can, like you said, inflamed, and other things are things that can happen to the hemorrhoids, which will make them to become symptomatic.
Okay, great. If you've just joined us, it's 18 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living with me, Nortey by nature. We're discussing a common medical presentation, even if you look at it within the traditional African medicine or medical confines, coko, right? But we've just been told by my resource person, who's a specialist or consultant gastroenterologist, that coko often in our local Ghanaian parlance is extended or expanded to refer to many other presentations and not just the rectal or anal complication we are talking about. So if you have any questions, concerns, WhatsApp is 055 1111 997. We're live on Facebook, and you should be able to direct your questions through me, through Joy 99.7 FM, to our resource person, Dr. Kenneth Yao Techi from Pando. I want to emphasize that.
Yes, very important.
Very, very important, from Pando. Right. Pardon?
If you are from Pando, you are called an Akpini.
Akpini?
Yeah.
Okay, right. We're learning. Okay, Doc, I hear that there seems to be a distinction between anal and rectal.
Yes.
And I heard you use anorectal and other, terms. Can you just distinguish that for my listeners? What do we mean when we say anal or anus, and what do we mean when we say rectal or rectum?
Okay, so the rectum is actually a continuation of your anus. Mm-hmm. For many of us, when you look, if you are able to look at the back passage, you see a continuation of your normal skin. So that skin begins the tube, and that is the part. So maybe the first 1 to 2 centimeters is your anus, and then just above that, the lining changes to what I described as what is in your cheeks, and that is where you would typically get these hemorrhoids. And so for the continuation from there to about the next 18 centimeters inside the tube is what is referred to as the rectum. Okay. So it's just a continuous tube distinguished by the lining.
Right. Okay. So in the example we used of the wrist and putting a tight band around the wrist to expose the veins or cause them to become distended or enlarged, with regard to the veins in the rectum or the anorectal passage, what would cause hemorrhoids or cause the distension of the veins?
Right, thank you. So a number of things, but if we should all understand that anything that would obstruct the flow of blood towards your heart. And I would start with very common things. And so if the ladies listening to us, many would know that when they get pregnant, the pressure in the abdominal area increases, and therefore that causes obstruction. And so many women who are pregnant will develop hemorrhoids. Again, if you're a woman and they have fibroids, it's the same mechanism. But also for persons who work in occupations where they have to sit for long hours, long distance drivers, office sitting, the sitting posture itself, cuts down. If you sit, you see that compared to standing erect, then the flow of blood is obstructed. So prolonged sitting is also a contributor to hemorrhoids. If you are obese, okay, so it's just like carrying a lot of load again in your abdominal or tummy area. That also causes obstruction to flow.
Right. People
whose, and I said sitting, but we can also look at it the other way. This is we all use the WC. And unfortunately, some people have turned the washroom into a library. And so you go sit on the WC for hours, or maybe not hours, but long minutes.
Right.
And you are reading there. That posture itself, promotes the development of hemorrhoids.
Right.
A very important contributor to hemorrhoids is constipation. So, of course, when you strain, you're trying to push things from up down, which means that you're preventing things from moving from down up.
Right.
And that is again known to contribute to constipation. In fact, that's a leading cause of constipation.
Right.
All right. Being inactive itself is known to because again, activity promotes blood flow towards the heart. So if you are inactive or less active, then the blood stays there and it's more likely to pull and cause distension of the vein. So these are some of the common causes of hemorrhoids.
Okay, great. 23 minutes past the hour of 2 on Joy 99.7 FM. We're having a very interesting and hopefully educative discussion on hemorrhoids, piles, Kooko, as we've specified in the introduction, with Dr. Kenneth Yao Techi of the gastroenterology unit of the Kolebu Teaching Hospital. He's a consultant gastroenterologist and also a senior lecturer with the medical school. If you have any questions, concerns, WhatsApp is 055 11 11 997. And I see a couple up there. This one says, good afternoon, Nortey. Please ask Dr. Techi the simple remedy for persistent heartburn, even after taking antacid. You see, Sami in Ekropong is waiting to do his consultation on Sunday afternoon. We'll talk about that in a bit. But let's stick to piles, right? So any concerns you want to share or express on WhatsApp, 055 11 11 997. I'm told by my producer, Abeku, that there's a challenge with Facebook as we are streaming currently, but it will be up, I believe, after the program, or you'll get the Facebook lead as well put up there. Right. So, Doc, we've examined some of the possible causes: long sitting, extreme pressure due to obesity, due to pregnancy, anything that may obstruct the flow of blood, and then I think constipation. All right. These are well understood. How would I know, since I don't go down there, are there signs and symptoms that may indicate that I have hemorrhoids? How would I know? Are there signs and symptoms?
Yes. So thank you very much. First, what I would like to say is that hemorrhoids are a very common occurrence. Indeed, data shows that 4% of the general population would have hemorrhoids at any particular time.
Right.
In fact, for persons who are above 50 years, 50% are thought to have hemorrhoids. So their hemorrhoids are pretty common. In fact, we believe that this data is actually an underestimation because, people feel very uncomfortable going to discuss things down there. And so not many of them will come to the attention of clinicians for us to document the true prevalence.
Okay.
The second thing I would like to add is that you do not need to go checking if you have hemorrhoids or not. Hemorrhoids are only important when they cause symptoms. So asymptomatic hemorrhoids, no problem. Right. And indeed, if we do any tests on you and we find hemorrhoids and the reason for the test was not hemorrhoids, we don't even bother to go treat these hemorrhoids.
Okay.
But how would I know that I have hemorrhoids? So, yes, the hemorrhoids are these distended things. They become a problem if they grow too large, if, like you said, if they get if they protrude beyond, so we describe that they are inside, but they can actually protrude outside and become visible because they become too large. It can bleed. It can cause itching. It can cause pain when it gets inflamed. Right. So these are some of the so you feel feeling of a mass in the rectum.
Right.
Pain, bleeding, which should alarm everybody. Okay. But what I would like to add quickly is that in all these, except for bleeding, which I think should alarm everybody, it's not enough. You cannot rely on these symptoms alone to conclude that you have hemorrhoids.
Okay.
In fact, anybody having any of these things down there in the anal region must be concerned about other things, because these symptoms can mimic what I would call more serious diseases. So you could have an erectile cancer and it will bleed. It would cause pain. It would protrude. So whilst I've mentioned these symptoms, I'm saying don't equate the occurrence of these symptoms to the presence of hemorrhoids.
Okay.
Now, the bleeding from hemorrhoids is also very classical. So sometimes you will describe these to your doctors, and your doctors may be a little more assured that these are hemorrhoids. So the bleeding from hemorrhoids are bright red compared to bleeding that you would get, for example, if you cut yourself. And you remember when I started, for the purposes of this discussion, I would say these are distended veins.
Right.
But in actual fact, we know that they are not just veins, but it's actually a collection of vascular tissue. So bleeding from hemorrhoids usually are bright red.
Okay.
And they tend to spread. So you'll see that if you use a WC, it would splash along on, around
the bowl or the
of
basin
of the WC.
Right.
Those are some of the things that would help us to identify that these are hemorrhoids.
Okay.
And of course, if you strain and you see a protrusion or the place becomes very itchy, again, hemorrhoids, because of certain complications, discharge from the hemorrhoids can cause itching, even though the hemorrhoids themselves don't itch. Now, but when we say symptoms, so these are symptoms. These are the things that you would complain to us, which would make us say that we suspect hemorrhoids.
Okay.
The next thing for a doctor to do then is to look for the signs of hemorrhoids. So examine you and come to a conclusion that you have hemorrhoids. Now, nobody can diagnose hemorrhoids simply based on the presentation, and I discourage practitioners from doing that because I've said that it could be a sign of a more serious disease. Again, many doctors would put a finger through your back passage to examine you. If your hemorrhoids have become large or they are protruding or appeared outside, the doctor may be able to say that you have hemorrhoids. But because these are veins and they are collapsible, when I put a finger there, it would collapse, so I may not feel it. So it's very difficult, again, for a doctor to put a finger through your back passage and say, oh, what do you have complained about? Is or are hemorrhoids?
Okay.
What every patient must get is some degree or some level of, examination of the back passage using an instrument. It could be a very office-based instrument and proctoscope. It's very short. You just put it there.
Something that does imaging.
Pardon?
Something that does imaging, that looks into
so the doctor
passage.
must visualize the hemorrhoid and be certain that these are hemorrhoids.
Okay. So you can't just do a digital rectal examination, put your finger up there, and conclude that this is a case of hemorrhoids.
I would not recommend that.
Okay.
Simply because there are more serious diseases that can present with the same symptoms of hemorrhoids.
All right. Great stuff. 31 minutes past the hour of 2 on Joy 99.7 FM. We're having a very revealing discussion on Kooko specific to hemorrhoids or piles, inflammation of the vessels down there in your lower regions or your anorectal region. Our guest is Dr. Kenneth Yao Techi. And we're learning a lot, and we're learning that a hemorrhoid or some of the signs and symptoms could overlap with other more serious underlying conditions. Hence the need for a thorough, conclusive assessment process, which our doctor has just kindly shared with us. If you have any questions, concerns, WhatsApp is 055 11 11 997. And our phone lines I will activate shortly. Let me see. Good afternoon, Nortey. Please get the correct pronunciation of the name Techi from the doctor. He said Tachi. Doc, I'm being asked to correct it. I'll come back to you in a sec. Right? This is from Francis Jarvis Tachi, I believe. Francis Medekukulo. Good afternoon. Hello, Nortey. Can hemorrhoids be operated upon? Learning a lot, though. This is Elinam in Adenta. We'll get to interventions. And then I have, please ask the doctor, I have a spinal cord injury due to an accident. I can't walk without crutches. I am always confined to the bed. As such, I have frequent constipation. What can I do to reduce the constipation and the pains? Okay. And then this one says, can hemorrhoids be a contributing factor for anal fistula? Kwame in Dansoman. Doc, the people are galloping away from us, but let me read a couple more and see if we can address them. Good afternoon, Nortey. Hemorrhoids, Kooko, affected my father, senior brothers, and now me. I read something like that just this morning. Yep. Is it hereditary? Thanks. I am Komla. Doc, is there a reason why I'm getting all your Voltarians responding? All right. Good afternoon, Nortey.
Support.
All right, support. Okay, voltaic support. Somebody is still typing. Wow, Abeku, you are moving too fast for me. Have I read all of them? I think so. right? There are a couple more coming in. WhatsApp is 055 11 11 997. This is Ultimate Health on Joy 99.7 FM. With me, Nortey by nature, I have Dr. Henry Yao Tachi. Efo Tachi.
Papa.
Can we respond to some of these queries? Now, one of the things I was going to ask is this hereditary thing, because I was reading from somebody in the US, actually, not from the Volta region, sharing that his father had it, and a couple of them also seem prone to it. Is there any, should I say, validation of this?
Yes, so there's definitely a familial component to hemorrhoids.
Okay.
So that, yes, if a member of your family has hemorrhoids, you are at a higher risk of also having hemorrhoids. And the simple reason is that, yes, there are some genetic or contributions to the vasculature, or to the veins and the firmness of the tissues that we described in the rectal region. So that's what to control. Persons with this familial history are known to have less firm, if you like, mucosal lining and veins, and that is what is known to contribute to the familial hemorrhoid.
Okay.
But it does not necessarily mean that if a family member has, you would also have.
Okay.
You just have to take the necessary precautions.
Right.
The question of, yes, definitely spinal injuries are known to contribute to hemorrhoids because they predispose first to inactivity and also to constipation.
Right.
And so persons, unfortunately, who have spinal injury would have to battle with some degree of hemorrhoids.
Okay.
And to answer that person, I think that he has to come to the clinic, and we can manage his constipation bit.
Okay.
And I'm sure that his neurosurgeons can manage his pain.
Problem. Right. Okay.
Yes.
Okay, great stuff. A couple more questions. Doc, let me just ask, how much blood are you losing? If you're talking about a splatter in the WC basin, and would this predispose you to anemia related to hemorrhoids?
Yes. So, in fact, I've seen people bleed from hemorrhoids and come with a blood level of 3, when actually the blood level should be above 11.
Wow.
So, remember what I said earlier. Many people are unwilling to report these things.
Okay.
In fact, in this week, I have seen an adult male who has been bleeding since August last year.
Wow.
And only came to me last week.
Adult male rectal bleeding.
Male. Yes, because he thought it was, and I suspect that he may have hemorrhoids. We are yet to go visualize it.
Right.
But people are uncomfortable reporting this. So you can actually bleed torrentially at once.
Wow.
And remember, I said that these are not vein bleeding. So it's actually your artery. And depending on which if it ruptures, it can bleed severely.
So as your heart pumps, it is gushing.
The typical bleeding is small bleeding. In fact, it might start with just blood on the tissue when you clean. Right. But you can drop your blood level to as low as possible.
Wow.
And people have died from bleeding hemorrhoids.
All right. But you did mention and you did signal earlier that by and large, they are benign and they are not a problem until they start to manifest or evidence these symptoms. Am I right?
Correct.
Okay. Right. So if you have any concerns, questions, experiences with Kooko, right, specific to the down under regions, that's what we're talking about. I know, and Doc has confirmed that it is extended to apply to other parts of the body, but today we are talking about the down under version, right, in your anorectal regions. We have an expert on the line. Doc, having mentioned expert or consultant, is this something that should be handled, should I say, by a general practitioner, or do we need somebody as qualified and specialized as you?
So, for every well-trained medical doctor should be able to diagnose and treat hemorrhoids.
Okay.
Because truth is, most hemorrhoids are uncomplicated. And when I say uncomplicated, so the little pain, the bleeding, can be managed by most doctors. Of course, occasionally, when you present to your doctor may send you to a gastroenterologist because they want to be sure that you're not you do not have any other thing up there or lower down. So for a gastroenterologist, for example, do the visualization or a colonoscopy to make sure that this is just hemorrhoids and nothing else.
Okay.
But otherwise, there are indeed many people who have hemorrhoids would have noticed themselves that certain lifestyle changes help.
Okay.
And so they begin to adapt these even before they come to the doctor's attention.
Right.
And some of the things they would have noticed, well, as you've mentioned, constipation contributes. So anybody who has hemorrhoids is encouraged to always maintain, if you like, soft stools.
Right.
And this can come from just increasing the fiber in your diet, taking in more fluids, and being more active.
Okay.
All right. So don't stay on the toilet bowl for long hours. Know that the toilet is meant for evacuation. So when you go there, if you 2-3 minutes, nothing comes, don't sit there and keep straining and straining.
Okay.
Move, come back another time.
Right.
All right. So, yes.
Doc, since you are the in there, down there plumber, so to speak, we go to the toilet and we do the do, right? We download Hotmail, all right?
Yes.
But so straining should be an indication that something is not okay. Is that's what you're suggesting? That if our diet is okay and we have all the fiber and all the necessary constituents, we should not strain when we go to the loo. We should not be straining.
No.
So if you are straining, it's already an indicator, a flag.
Well, let me clarify. You have to strain to evacuate, but I'm sure everybody excessive straining.
All right, excessive
straining.
All right.
Should not. Yes.
Okay. Right.
And if you strain one, a little, something comes out.
Right.
But if you strain, nothing comes. You strain the second, and then there's a problem.
So it's not a fight.
Yes. I like that.
Okay, right. But the other thing I wanted to ask before I give you a breather and then try to read some of my messages and hopefully take some calls is that I've read that the WC, though, let me call it an innovation or technological advancement, which we are quite happy with, right? Puts us in a position which doesn't suit our digestive tract and doesn't suit easing. And actually, evacuation, if I can use that word, actually we're designed to squat.
Yep.
And therefore, I've seen and read researches and watched videos where you are encouraged to place a kind of footstool or step in front of your WC to elevate your knees to actually simulate a kind of squatting position. Can you comment on that quickly before I take a breather to go?
Yes.
Yeah.
So you're absolutely right. The way our forefathers used to evacuate or go to toilet was the right posture.
Free range.
If you remember, the last week I tried to describe the anatomy and the alignment of the rectum.
Right.
Now, sitting on the WC is a wrong position for evacuating that tube.
Okay.
So, especially for persons who have problems with constipation, we encourage them that when you sit on the WC, have a stool, and so that your knees are above the level of like your buttocks, or more towards your knees are, below or above the level of the WC. So that puts you in a position like great grandfathers used to do.
Free range. All right.
And that aligns the rectum very well, and it's easier for you to evacuate. The other thing we recommend anybody having problems with constipation is to every day, maybe after a meal, just go to the WC and attempt to evacuate, because some reflex is set up and you can take advantage of that to help you in the evacuation.
All right, great stuff. I'm going to switch and try and read a couple of messages and come back to my guest, gastroenterologist, Dr. Yao. And he spells his Y-A-W. I thought it would be Y-A-O, but that's his name. Let me read a couple of messages. Okay, this one says, this is from Francis Jarvis Tachi. We hear stories like don't eat okra when you've got Kooko. Any scientific basis for this? This one says, good afternoon, Nortey. Does alcohol intake cause or accelerate the development of hemorrhoids? Joe in Tema. And Doc, if you could take note of these questions. This one says, good afternoon. I have serious hemorrhoids. I have bleeding for over 10 years now. Wow. I went for endoscopy to confirm that, and I'm preparing for a surgery. But of late, I've been experiencing serious waist pains. 1, may I know if my waist pain is a result of this condition? And 2, is surgery safe for me? This is Selom in Adenta. This one says, good afternoon, AFO doctor. Please, can hemorrhoids develop into anal fistula? Esinam in Ho. Wow, doc. Regional representation. Nortey asked doc if varicose veins can predispose you to coko. Does lubricating the anal passage with shea butter help? AL in Tema. Can hemorrhoids be a contributing factor for anal fistula? This is Kwame in Dansoman. I think we've read that. Are hemorrhoids infectious, transferable from an infected or affected person who has used the toilet to another? Ultimate Health on Joy 99.7 FM with me, Nortey by nature. Doc, can it cause anal fistula? All right. Okay, you guys are fixated on fistula, but it tells me I have discerning listeners. Good afternoon, Nortey. I had hemorrhoids operation about some 20 years ago, and of late I've been experiencing enlargement of the prostate, which affects my anus. Please, does prostate and hemorrhoid have common links? Thanks, FM in Pram Pram. Good afternoon, please. There are these black spot-like growths that can occur on the skin around the neck and other parts of the face, which others refer to as coko. Please, how do we avoid and treat these growths? From Niaite in Dakuman. All right. I don't normally bleed. Please, which one is this? Good afternoon, Nortey. I'm suffering from this ailment. It comes out each time I ease myself that I always have to push it back before I would be comfortable. It was small, but it is growing large, that when I'm pushing it back, I feel pains. I visited the doctor and was given some medication that she said would shrink it, but up to now, I can't see any sign of shrinking. I don't feel any pain when it is inside, but the moment it comes out, I feel pains. I do not normally bleed. All right, I have a lot for Dr. Tachi. The airway pronunciation of coko is, Mauli says coko, cocoa. This is from Mauli, cocoa, spelled cocoa, but all right, I'm trying to airwaylize it. The same way alligator is alligator. Doc, are you there? Evoyao. Okay, Nortey, I'm Sam. I've been experiencing pain in the waist when I stand on my feet for long working. Also, stomach pains, taking medication, famotidine, which might be the cause. I don't quite get it. So,
hello.
Yes, Doc. Is this Doc? No. Dr. Techi? Hello?
Hello.
Yes, is it Dr. Techi or a caller? Hello?
Hello.
Yes, Doc, are you back online? It looks like I'm getting a mix-up a bit between a caller and our resource person. We'll take calls in about 3 minutes. Let's see if we can get some answers for some of these WhatsApp questions. So let's put Dr. Techi back. If you've just joined us, 47 minutes past the hour 2 on Joy 99.7 FM, part of our Ghana Month, we're looking at common medical presentations. Today we're looking at hemorrhoids, piles, or coko, specific to the rectal area. Doc, are you back with me now?
Hello.
Yes, Doc, I can hear you.
Correct, I can hear you.
Okay. Were you able to note the flow?
I got many of them.
Okay, can we have some of your responses, please, kindly?
So yes, so quickly I will run through them. No, hemorrhoids are not infectious. So if somebody uses a toilet and you go use it afterwards, you cannot get hemorrhoids. Okay. Can hemorrhoids cause anal fistula? No, hemorrhoids on their own cannot cause fistulae. However, inappropriate treatment of hemorrhoids. So fistulae basically are a connection between the rectum or the anus and the skin surrounding the anus. So sometimes people do all sorts of things to their hemorrhoids, and then that can now create a tract between the lining of the rectum and the skin. So hemorrhoids, if left alone or treated by qualified persons, cannot cause an anal fistula.
Great.
Any correlation between varicose veins and hemorrhoids? Yes and no. So varicose veins do not cause hemorrhoids. However, the conditions that predispose to hemorrhoids, remember what we said, if there's an obstruction, basically that obstruction is also affecting the veins on your leg. Okay. And therefore, those veins would equally become prominent and can also, and then just as you develop hemorrhoids, you would also develop varicose veins. But one does not lead to the other. Okay. Is there a relationship between prostate and hemorrhoids? Yes. Persons who have prostate disease or enlarged prostate typically would have to be straining at maturation. Okay, when they want to pass urine, they have to strain a lot, and that is very similar to the kind of straining we describe for constipation. And so, indeed, if you have hemorrhoids and you're going to have enlarged prostate, your prostate issue must be sorted out before you go for hemorrhoid treatment. Okay. The person who has to push this protrusion back, if those protrusions are hemorrhoids, then it means that this person now has what we call a grade 3 hemorrhoid. Right. And because, if it's inside, it's grade 1. Right. If it comes and goes on its own, it's grade 2. If it comes and you have to manually push it back, it's grade 3. And if it comes and you cannot manually push it back, then it's grade 4. Okay. Grade 3 and 4 hemorrhoids on grade 3, let me deal with grade 3. Right. Do not respond very well, or the response to medical therapy is low. Okay. And so if a trial of medical therapy is failing, then this person should see a doctor, and then they can go to the next level of treatment. Okay. Can hemorrhoids cause waist pain? No, hemorrhoids on their own would not cause waist pain. Right. But unfortunately, or oftentimes, it's the same disease which is causing the waist pain, which is also causing the hemorrhoids. Okay. And so it's not like the hemorrhoids causing waist pain. Right. Somebody had a growth on the face, which they think is hemorrhoids, like we've said. In traditional medicine, any growth or severe disease is now attributed or classified as hemorrhoids, but medically that's not a hemorrhoid, and so that person has to see a specialist to decide
are those what we call the liver warts? Are they what we call liver warts? On black skin, it looks a bit like freckles, but it gets a bit bigger. Yeah. Yes, so it
could be. Yeah. In fact, there are actually some growths also. Which are residual effects of hemorrhoids, which is like anal tags. So sometimes you look at the anal region and see all these black, tags or loose skin. They are oftentimes complications of hemorrhoids. So the hemorrhoids, before they become painful, oftentimes are thrombosed. So there's a clot in there, and that can get acutely painful. Right. And so after a couple of days, the blood recedes, and then it leaves the sac that was containing the blood outside, and you see these as anal tags. Okay. Some very daring people go cutting these off, and if not done by a professional, you may end up with an anal stricture, which is a bigger problem. Right. Okay. So we should be playing around with these things ourselves. Somebody suggested that they'd had surgery and they've had some recurrence as well. Somebody also mentioned that they've been told that they would require surgery, and they're asking, would surgery be good for them? In the absence of any further details and specific patient history, are you able to comment on this? Yes. So surgery definitely is an option, like I mentioned, especially for grade 3 and 4 hemorrhoids. Okay. And 99% in experienced hands, surgery for hemorrhoids is effective. Surgery, if done well, should not recur typically, because what the surgery involves is to remove those vascular tissues. Okay. And so should not recur. So the recurrence rate really is very low. Okay. What I would say is that if you're having symptoms of recurrence, please see your doctor and let them confirm that these truly are hemorrhoids. Okay. Because like I have said, there are many things that can mimic hemorrhoids, and so we should not, and sometimes these are very serious diseases, and so we should not play with these symptoms and classify them as hemorrhoids when they truly would be something be something more serious.
Great. We have a couple of minutes left, Doc. I'll give you a breather. I'm wondering if traditionally we have an equivalent to a gastroenterologist in traditional medicine, or are they just classified as traditional healers? Is there anything you know of persons who specialize in traditional medicine in the gastrointestinal tract? And then the other thing I want to ask you before I give you a breather and then come back and also allow some phone calls is, Charlie, this job down there looking and visualizing and all these things, I'm looking at your face. You're seeing stuff, right?
Yeah, but he's very used to it. I mean, I tell people who come to the endoscopy, let's say senior residents, trainees, that I mean, these days I encourage patients when they come that this is the only place we don't charge latrine fees. So feel free, bring it out whilst we are doing our procedure. And I could step out of the colonoscopy room and be having a cup of coffee.
Wow.
We're used to it.
You finish looking up somebody's derriere, and then you have a cup of coffee.
Right next to the procedure room.
Wow. Yeah, Prof. Akosa used to tell me that I think his father-in-law years back asked him whether he eats meat. And he's a pathologist. All right, I'll give my doc a couple of minutes and see if I can retrieve some of the messages I have here. Stick and stay. Joy 99.7 FM Ultimate Health. We're talking about piles. Phone line is 030-2216-541. I'll be back. All right. Okay, let me also take a breather. All right, this one from Kay says, hello, Nortey. Which foods cause or predispose a person to piles? Is there any home remedy to soothe the pain? Hopefully we can get to touch that or carry on next week. Please, can we have the doctor's phone number? This one says, Nortey, I'm Sam. I've been experiencing waist pains when I stand on my feet, working, stomach pains from taking the medication. Let me see if I can pronounce it properly now for Doc to hear. Famotidine, right? Famotidine. What might be the cause, right? He gets waist pains and he's taking some medication. He's asking what the cause is. Can we please have the doctor's phone number? I typically tell you where the doctors or resource persons are located, and unless they give me express permission, we don't give out their personal numbers. So, Doc, coming back quickly, any foods that predispose to piles, maybe constipation?
Yes, so foods that low fiber diets predispose to constipation and therefore hemorrhoids. And so let me rather say the foods that you should eat would include, make sure that your diet is balanced, have vegetables, fruits, and taking a lot of fluid.
Okay.
These are the things which would, but if you're just taking in rice and no veggies with it, you will predispose yourself to
right. So essentially those would be preventive measures or
exactly
right, to prevent the piles from occurring in the first place. All right.
And indeed, actually, when you actually have the piles as well, we recommend it.
Right.
I forgot one. Somebody asked shea butter.
Yes.
So there are topical treatments, that we give, and of course, when you have these hemorrhoids and they are painful, we make sure that the stools that are coming out are soft and sometimes also oily.
Right.
So that it causes less abrasion to the exit.
Laxatives and other things, yeah?
Exactly. Home remedies for the pain. So yes, definitely sit back, but there's a caution there. So if you put some warm water there, it's great. So if you can get a shower and then just blow it to the back, it's great.
Right.
But if you use the big bowl and you sit in it, remember what we talked about sitting on the WC.
Right.
So you have to make sure that your sitting posture is good if you're doing a sit back. Otherwise, it can actually predispose you to more hemorrhoids. There are also, medical therapies. So for grade 1 and 2, your doctors would often prescribe, oral medicine, some topical. So I'm sure many people know some medicines they're giving insert.
Right.
Those that you insert actually are just relievers. So they might relieve the pain,
Okay.
but they don't cause regression of your hemorrhoid. There are some oral medicines, diosmins, which can cause some shrinking for grade 1 and 2 and some amount of grade 3 hemorrhoids.
Okay.
But the majority of grade 3 and grade 4 hemorrhoids would require surgery.
Okay. So the higher the grade of the hemorrhoid, the more serious or severe the presentation and the symptoms. Okay.
The bigger it is, but you can actually have a grade 1 hemorrhoid which can bleed severely.
Okay.
Yes.
Right. Now, we hear a lot of traditional practitioners, those who sell these herbal products, they even have songs and jingles about Kooko as if it's a laughing matter. But from our discussion with you, there are serious underlying issues that have to be properly investigated. Am I right, Doc?
Yes.
Right. And I was also going to add, you mentioned people uncomfortable about presenting with these symptoms that we mentioned, but could there be the aspect or the factor of fear? Because when you see blood in your stool or in the WC and all that, you tend to reckon that there's something very, very serious going on. Could that be part of the problem as well?
Yes. Maybe that could be the reason, but I get very surprised because the general population usually when they see a little blood, they are scared and they become very alarmed. So I would expect that when you see blood, if pain doesn't bother you, the presence of blood should bother you. But interesting, and like I cited, I've seen somebody last week who had been bleeding from August last year, and I'm thinking, so if blood doesn't scare you, then nothing else will scare you.
Right.
Okay, so. It's a problem, but I'm saying hemorrhoids are very easy. In fact, when you come to the hospital, if your hemorrhoids are bleeding, it's just a 2-minute procedure. We can actually stop it for you.
Right.
So we apply some rubber bands to it and stop your bleeding. So it's nothing scary. The majority of hemorrhoids can be treated safely without problems. So people should not be worried.
Right.
Yes.
We've run out of time, but Doc, very quickly, so what? I mean, there are people looking for your number, okay? I'll give you my protection for now. But if you present at a facility, where are you going? Who are you asking to see? You're obviously not going to the general OPD, or should you start at the OPD?
Like I mentioned, the majority of qualified doctors should be able to diagnose hemorrhoids and treat grade 1 and 2 hemorrhoids. If it gets a little complicated, if you're bleeding, they would definitely make the appropriate referral. And there are, surgeons who can deal with hemorrhoids, physicians, non-gastroenterologists who can manage hemorrhoids. The real role of the gastroenterologist oftentimes is to just visualize the hemorrhoids and confirm the diagnosis. Many times, other clinicians can treat hemorrhoids.
Right.
But certainly, you must seek appropriate medical advice.
All right. Great stuff, Doc. And then lastly, what I was going to ask is about these surgeries about those herbal preparations that are out there in their zillions, purporting to treat, sometimes even cure this. There's one aspect where you are reducing or managing symptoms, but the underlying hemorrhoid problem persists. What would you say to those who are buying and patronizing these products?
So, not to spoil anybody's business, but some of these herbal remedies or traditional remedies tend to induce or treat constipation. And sometimes they overly treat it. So many people would end up with diarrhea, when really it should just be treatment for constipation.
Right.
Beyond that, they have seen some of these remedies are actually designed to be inserted. And like I mentioned last week, one of the dangers of repeated insertion of things is that it causes changes to the mucosa or the lining of the rectum.
Right.
And the frequent replacement predisposes one to a more serious disease, including cancer. It can cause stricture, and so now passing stools become even more painful and more difficult. So, without, I'll be very careful if I have to use any of these things and be sure very well before And so I would not recommend it because they are really very simple medical remedies for this as well.
Right.
And equally cheap. And so I don't, and sometimes the traditional ones end up being even a lot more expensive.
Great.
So seek the appropriate medical advice from a good hospital.
Medical advice from a good hospital. Dr. Kenneth Yao Tachi, consultant gastroenterologist and head of gastroenterology at the Kolebu Teaching Hospital. He's a senior lecturer with the University of Ghana Medical School. Many, many, many thanks and gratitude to you, and of course to my discerning listeners as well. Another Ghana Month edition of Ultimate Health. Stick and stay. There's a lot of music to come, but I will leave you with what I started with, and then there's more music to come on Joy 99.7 FM. My name is Nortey by nature, produced by Abe Kunsan Kofi. Stick and stay.
Thank you.